actually to start with Dr. Aimee and from the medical perspective. Yeah, Dr. Aimee, thank you so much for joining us and sharing your expertise with us today. So let me start with the definition. So what is actually infertility and what it is?
I mean, the textbook definition is the inability to conceive after 12 months of trying. But I always tell people 100% of us are going to have infertility if you run out of eggs, and that's what happens to all women. And what we're seeing now are people are trying at later ages and they're starting their families when their eggs have run out. And I just find that so incredibly unfair. So I love being invited to talks like this, because then I can educate people about the levels you can check and the things that you can do to get ahead of infertility before your precious eggs run out. I know that was not what you were asking for, but I just had to say that as part of my answer.
No, it's beautiful, and I think it's very important to understand that there are some things that you can do to improve your fertility, and maybe we can switch to that topic.
Yeah.
So what actually, are there any changes that we can implement to improve the fertility?
Yeah, I mean, the things that are in your control, like right here and now, is taking really good care of yourself. It's as simple as that: sleeping well, hydrating, exercising, eating healthy, avoiding toxins. And that sounds like really basic, but I think that there's so much shame that goes into being a fertility patient. And when you're struggling, sometimes you don't treat yourself really well. And you say things like, okay, as soon as I'm pregnant, then I'm going to be healthy. As soon as I'm pregnant, that's when I'm really going to exercise. But I want my patients and anyone who wants to bring a baby into their life to really treat themselves as if they're already pregnant. Imagine that it's already happened to you, and do all those things that you imagine you would do, but do them starting now. So all those like lifestyle medicine things that you hear doctors talking about, those things can all help improve fertility also for men and for women. Avoiding toxins include things like cigarette smoke, vaping, nicotine pouches, alcohol, especially binge drinking, heat exposure for guys. So those are some of the simple things that people can do today to potentially improve their fertility. It doesn't fix everything, but that's kind of where you can start before you start seeing a doctor.
Yeah, this is I'm happy that you mentioned that infertility affects not just women, but men as well. And I think that's a very important stats to mention, that actually 1/3 of all the infertility cases are men factor. And then 1/3 of the common cases are also men and women. So it's basically 50%, right? So can we talk a little bit more about men infertility as well, what it is?
Yeah, I mean, so male infertility is basically when the sperm count's low, motility is low, morphology is low, sperm DNA fragmentation is high, and there are a number of reasons why that can happen. They can be genetic, they can be environmental, it can be due to a medical condition or medication a guy is taking. Sometimes men who have diabetes that's not well treated, that can cause issues. Some guys are prescribed testosterone incorrectly because they complain about erectile dysfunction, and that can actually wipe out their sperm, but instead they should have been on other medications to build up their sperm. So I tell my patients to have a visit with a reproductive urologist as well as seeing me, so we can fix things on both sides. And I have, one of the things I'm known for are really cheeky websites or mnemonics or acronyms, and one of them is the BALLS method. And so I have the Tushy method for the female side and the BALLS method for the male side. And that basically encompasses your background genetics. So looking at things like chromosome analysis, carrier screens, sperm DNA fragmentation, anatomy, ruling out a varicocele, labs like testosterone, lifestyle, and talk about supplements and sex. So those are just basically like the simple 5 things a guy can think about, talk about, and just kind of see if any of those things are abnormal, see if you can fix them at home, so that if you actually do need treatment, then you're putting, what is that saying, your best foot forward. So you're giving yourself the very best chance in the treatment that you're doing. You don't want to look back at records and after treatment that doesn't work, and then say, why didn't anyone tell me that maybe I shouldn't be in the hot tub or taking a bubble bath every day as we were going through IUIs? This is for the guys. There are guys that take bubble baths, really hot ones.
Yeah, that's great. So what is, if we think that we have some issue with infertility, so what would be the first steps to take?
I mean, the first steps, you can actually do all these 5 steps, the Tushy method, in basically 1 month. You can get, and I'll just kind of walk you through it really simply. So let's just say your period starts. Okay. Cycle day 3, you can get your FSH, estradiol, and AMH levels checked. Okay. So that checks your ovarian reserve. Cycle days 8 through 10, you can do a hysterosalpingogram to check the fallopian tubes. In between the blood draw and the HSG, at some point there, you'll do an ultrasound to look at the size shape of the uterus, ruling out things like fibroids, maybe polyps, maybe endometriosis. In the meantime, you can also, for example, do a carrier screen, and that can be done through saliva or a blood draw. You, and if you're partnered with a man, can both get them done. And he can also order a semen analysis at the same time. Within a month, you'll have a diagnosis potentially, and then you can make a plan from there based on your age, when you want to start trying, how many kids you want, how old you think you want to be when you have your last child. So I call that the egg whisperer way.
No, this is great. For everyone who doesn't understand this is only possible to do in fertility center with reproductive endocrinologist because that's not done in OBGYN office. You have to see reproductive endocrinologist to go through all this testing that Dr. Aimee just mentioned. So on that point, can you tell us a little bit more on how to choose your doctor? So the first step would be for us to understand where to go and how to choose the doctor and how to think even about it.
I mean, we're so lucky. There are many fertility clinics that actually take the same approach, and they believe in the same things that I do, that every person before they embark on their pregnancy journey should have a pregnancy readiness exam and talk to that's my thing. You know, talk to a fertility doctor, especially if you're over the age of 35, starting your family, about what your goals are, so that you don't miss out on an opportunity to preserve your fertility. So if you're not finding that you're meeting with someone who understands how important your fertility is, then that's not the right place for you. The last thing you would want to do is go to a clinic that says something like, try for a year, and then if it doesn't work, then I'll do some tests. That's not the right clinic. But the right clinic for you is someone that says, oh, I totally agree with you. I'm so glad you came to us. This is exactly what we do here, and we'll get you set up for some tests. Most fertility clinics have that same philosophy.
Yeah, I love that. And we touched a little bit the topic of prevention as well, which I'm very passionate about. So what can we do to preserve our fertility?
Yeah, I mean, simple things not related to going to a fertility clinic could potentially be something as simple as CoQ10. So I tell every person that I meet, if you're not done having kids, start CoQ10 now and just continue it until you're done. That might preserve, it might slow your rate of egg loss over time, potentially. So that's one thing that you could do. Then the other options would be easy for a guy, which is freezing sperm. So if, let's say, you guys are starting your family at 38 and he might be 40 when you have your second or third baby, you might want to freeze sperm now to use sperm for pregnancies in the future. Then the other thing would obviously be egg freezing. And people who are coupled, actually, I don't think they hear enough about the power of embryo freezing to preserve fertility. So I think there's so much secondary fertility out there. And what happens is people have their first baby, then they like recover from all of it. 3 years later, they're like, I'm ready for my second. And then they're now 3 years older, maybe they're 39 or 40. But what I want OBGYNs to get in the habit of is when you go in for your postpartum exam, maybe have someone talk to you about, should you freeze embryos? Should we get your AMH level checked and kind of understand where you're at so we know what your options could be when you're ready for your second baby? And then depending on what that timeline looks like, perhaps preserve your fertility as you're enjoying your first child or second child.
Yeah, this is beautiful. I myself did embryo freezing. Anya did egg freezing. So can we tell a little bit more about what the differences are between the
Yeah,
two pluses and minuses?
absolutely. I'm very funny on Fridays. Okay. And the reason I bring that up is I'm just going to tell you all my jokes. So basically, egg freezing is like IVF without the effing. Uh, and the F word that I'm using here is fertilization, not the one that probably everyone thought I would say. So when you go through the process of egg freezing, you're literally going through IVF. You're taking an injection every day, stimulating eggs to grow. Then you undergo a procedure under light sedation or anesthesia. And the doctor is taking a needle, going through the wall of the vagina into the ovary, which you're not going to feel it, but it's like draw from the ovary. And then what you do is you freeze the eggs that day if you're doing egg freezing. If you're doing IVF, then you'll have either your partner or a sperm donor vial on site to either collect a sample, or the embryologist will thaw a vial and they'll put the eggs and sperm together and then grow them out 5-7 days to find out which popcorn kernel in the incubator or microwave popped for them to take it out and freeze it for you for your future. And with that, you can do genetic testing as well. So they're very similar procedures. You feel spicy, snarky, bloated, crampy, excited, disappointed, all the feelings as you're going through this. And so what I tell people when they're thinking about egg freezing is that egg freezing is preserving future chances for fertility. And so I always think through, like, what can I do to educate people more about it? And there's all sorts of things that people experience as they go through this process, especially when you come back for eggs, let's say years later. So I've seen stories, heartbreaking stories of someone who's, let's say, 44 and she froze her eggs when she was 35 and now she has nothing. The eggs didn't survive. And now she's like, why didn't someone tell me that could happen? So I'm saying to myself, I actually woke up this morning thinking this, maybe I should encourage women, if you're going to delay childbearing to, let's say, at an age where you've run out of eggs, maybe you should freeze your eggs every 2 to 3 years until you're ready to start your family, so that you have as many options as possible, because you just don't know what's going to happen once you thaw them.
Yeah, I have a very heartbreaking story. The patients that had only 4 eggs, and when they were doing egg freezing, they thought they are ahead of the game, but no one told them that that's the numbers game as well. And
Yeah.
when they came back, they actually couldn't get pregnant because of that.
Yeah.
Yeah, that's very
What is
sad.
a good age for overall holding the eggs in the cryobank? Is it 2-3 years, as you mentioned, or how long can it be preserved for?
Indefinitely. So there's no expiration date, so to speak. They don't, go bad or have freezer burn. My thing is that as time passes, staff changes, the technology in the labs changes. So sometimes the media they use change, the kits, they might not be available anymore. So it makes thawing them a little bit more difficult, because things can change in the lab and you just don't know it. So that's why I encourage people to not just do one freeze if, let's say, they're going to delay having a baby by 10 years, for example. But you can thaw an egg, 10, 15 years later, and it should be just as good as when it was frozen.
Yeah, a lot of people also asking what is the right age for egg freezing. So what is your opinion on that?
I mean, depending on your age, I would say right now. But I mean, I definitely see women who are, 25 years old, they have a really high egg count. And I say to them, there's no rush. If you want to do it in the next few years, that's great. But I tell patients, if you're like 28 to 31, make sure you've checked your levels, done an ultrasound, talk to your mom, talk to other family, see if there are any fertility threatening conditions in the family, like endometriosis or fibroids or a high-risk cancer gene. You just don't want to find out those things too late and wish you had done egg freezing at a younger age. But I would say for most people, 25 is a great age, 28. For some people, 32-year-old eggs could perform just like their 28-year-old eggs. But I would also encourage women, if you're over 35, to think about egg freezing. Even if you're 40, it could be something that could be useful for you. So I don't want you to feel discouraged or shamed out of doing it if you feel like it's important for you to do, even when you're over 40.
Yeah, no, I think this is a very great point to make, that, yeah, so don't think this is not right for you if you're not 25 or 35.
Right.
Any limitations in terms of fertility preservation, both embryo and egg freezing? Everyone can do that, or there are some limitations though?
There are limitations, and I would say I take this process very seriously. It can disturb someone's mood. And so if someone is really sensitive, if they have anxiety or untreated depression, this is not for you right now. It's really important to work with psychiatrists, psychologists before you go through the process. And I'll just give you one example. So let's say you showed up here and you're a very anxious person, and one day I see 14 follicles and the next day I see 12. and you suddenly think that the world is over because the egg count went down, and now you're thinking about every month losing 2 and you're going to go to menopause a year later. You know what I mean? So I feel like it's a very emotionally charged process to go through egg freezing. So it isn't for everyone. You have to be able to understand human biology before you even go through it, and understand it, that if you start with 14 and you get, let's say, 6 frozen eggs, you now have gained 6 eggs that you never had before. So that's one thing. The emotional and mental, psychological impact that egg freezing and even IVF and embryo banking, what that can do to us is not to be taken lightly. Then the other aspect is women who have a high risk of blood clots. So there are some people who have genetic predispositions to forming blood clots. They might have factor V Leiden, prothrombin gene mutation. So I ask the family history related to that. And then I also test my patients for those genetic predispositions before I even start the egg freezing process. So if someone has a history of many clots, then it may not be the best idea for you to go through the process with hormones. You can still do it in a way that you're not exposing yourself to so much risk. Then the other side of it is body size. So you have to talk to your clinic, depending on what your body size is, about what their limits are for BMI. We know that BMI is not the best indicator of health, but operating rooms will have a BMI limit. The operating room I work with has a BMI limit of 38. So it's important for you to have a BMI of 38 or below before you start IVF. Otherwise, we can't do your procedure. But overall, most people are excellent candidates for egg freezing as long as they understand the limitations. They're not feeling misled. If, let's say, the story you told me about the woman who froze 4 eggs, that would be so incredibly sad for me to have taken care of a patient like that. I mean, that would never happen for me because I just talk too much and give people too many options. But those are the kinds of things that I want to prevent, because you can imagine that patient's probably pretty pissed right now, that no one told her that.
Yeah, no, I felt really terrible for them. But yeah, so I wish they had a doctor like you, so to say, at the beginning when they were even thinking about it. Yeah, no, that was great. Thank you so much. That was such a deep dive into all things fertility. I want to switch gears a little bit and ask Anya about her experience as a patient, because she went through egg freezing recently. She also has endometriosis. So Anya, maybe you can tell us a little bit about your diagnosis, because a lot of people at this call have similar diagnosis. So how were you diagnosed? Can you share a little bit about that?
Yes, definitely. And what Dr. Aimee mentioned about the roller coaster and the egg count jumping from one number to another, that also happened to me. I'll get into that later too. So I was diagnosed with endometriosis about 4 years ago. And it started with a very sharp pain in my stomach, in my belly. And I really couldn't understand where this pain is coming from. It was radiating pain that would hold on for about 24 hours and then go away. And it wasn't at all connected to my cycle days. And after that, I started noticing, I started experiencing a little bit of the pain during sex. And also, when I went to the doctor actually I went to my primary care physician first, and she suggested that I need to check in with my OBGYN. And my OBGYN, when she did the ultrasound, she saw some chocolate cysts, how they called. And those three symptoms, the abdominal pain, sex with the intercourse, and also the chocolate cyst, it led to the conclusion of the endometriosis. And I was put on a very small dose of hormonal birth control, which helped me to maintain my ovaries to a little bit smaller size. And this way, my endometriomas also shrank. And now it's very much maintainable, and I don't have pain anymore.
Well, that's great to hear that you were able to find the treatment. So
I'm very
egg
fortunate.
freezing, but then how did you decide to do egg freezing? How did you come to that decision?
Yeah, I'm 33 years old and I have endometriosis. And also, I recently found out that I have genetic predisposition to ovarian cancer also. So, and I understand that it's basically, I'm a good candidate for egg freezing. It's something that it's likely that in a few years I'm not going to be able to get the fertility level as I have now. So I decided to do that about probably a half a year ago. And I was trying to find the time that is going to be for a few weeks at least, and I'm going to be traveling anywhere, and it's going to be a little bit more quiet with work. I wasn't like Dr. Aimee mentioned before, just like the lifestyle was comfortable at that point. I was feeling healthy and not stressed out. So, and I've done my egg freezing cycle. I started it in the beginning of June. So I recently just finished it a few weeks ago. Yeah, that's been my journey so far.
Wow, so that was a very recent. So
Yeah, super recent.
so maybe then you can share what the process is. Actually, I'm sure that a lot of people want to know what it is and how does it feel to be
Yeah,
going through
totally.
egg freezing.
So first you go to a fertility assessment. Fertility assessment in a fertility clinic consists of the blood work and ultrasound and a consultation with a doctor. It was great to overall know the baseline for my fertility. So they counted the number of follicles I have on my ovaries and what is the level of AMH and other hormones. So it was okay. It was a little bit lower than the average, but I'm still a good candidate for that. And after that, when I decided to get into the egg freezing itself, I waited for the first day of my period to start because I have endometriosis and I was on this pill that was shrinking my ovaries. The fertility doctor suggested to get off the pill for at least 1 to 3 months in order for the ovaries to relax and get into their normal state. And it actually helped to increase the number of follicles after I got off my hormonal birth control for 3 months. And after my first period started, after those 3 months, I went to the first appointment and at the fertility center where they done the ultrasound and blood work again. And from that day, they sent me the prescription for the medical hormonal stimulation. And after that, I was taking the hormonal stimulation every day for 10 days. And I was going to the doctor from time to time as well to do the ultrasound and blood work to see how the hormonal stimulation is affecting my body. It was affecting well. There were no changes in any. It was stimulating well, pretty much. And after 10 days, the doctor suggested that the follicles grew good size of the eggs, and we scheduled the retrieval day. In 2 days, I had to do the different retrieval shot. And after retrieval is basically 15 minutes procedure. I was under local anesthesia, and I was a little like sluggish that day, so I took the day off. But pretty much the next day I felt pretty normal. That's it.
Yeah, so any misconceptions that you had coming into the process?
Yes, totally. I thought it's gonna be longer. I thought it would be like months that I'm not gonna be able to work or function well. It was just 2 weeks, so that was a little bit shorter. And also, like, I was very scared of the needles and how to put in hormonal treatment. It's very scary, like thinking about that. But when you do that, you're like, it's just the flesh and blood, and it's pretty easy. I did it on my own, and by the third day, I was like professional doing the shots.
Well, yeah. Well, I'm glad everything went well. That's really good to hear. So I have the question for both of you. And the question is, we have a lot of people who are thinking about egg freezing. So, and they want to know your recommendations. So what would you recommend for those who are considering egg or embryo freezing right now? Any tips? So Dr. Aimee, I will start with you.
I mean, I would say the first thing is to get educated about the process. So do your research, understand what the risks are, just like she was describing the shots and the appointments, kind of read more about that, how the shots are going to make you feel, find a good time in your life to do it. And then the other thing I would do is get checked, find out what your diagnosis is. You might not have a diagnosis going into egg freezing or embryo freezing if you're not someone who's been struggling to conceive, but understand what possible things, I know this sounds very negative, but I'm a worst case scenario kind of person. So talk about what are the worst case scenarios? What might I learn through this process that you'd want me to know now? And those things are how many follicles you have, the number of eggs that you could get. If you're doing embryos, how many embryos you could get. So it's all about doing your research and then doing research about yourself and being more knowledgeable about yourself. And then finding the right clinic for you. You don't want to look back and be like, oh my God, I wasted 6 months of my life on a clinic that didn't care about me. They didn't call me back. They didn't bring me in for appointments. They clearly don't have the time for me. And this is, if you're feeling that in the beginning, then it's time to move on. And then right after your egg freezing. So what happens in a lot of places, unfortunately, is once you're done with egg freezing or your IVF cycle, it's like they're done with you. And I just see that as a common theme everywhere. Not everywhere, I should say, I should correct myself, in a lot of places. So as soon as your egg freezing is done, you have to then set up a post-egg freezing consult to talk through, what did we learn? What would you do differently if I should do this again? This is the number of kids that I want. How many more cycles do you think I should do? So you should ask those questions right away when they're fresh on everyone's mind. Same thing for IVF. You just got your genetic report. Schedule that post-IVF consult right away. Don't let them give you an appointment in 3 months. I always bring my patients back in within like maybe an hour of receiving their genetic report. Okay, maybe like a day or two, max, right? But I'm hearing these stories where patients are given appointments like 2 months later. You just gotta give them hell and make sure that your priorities are yours, even though they aren't treating you like a priority. You just have to fight what's right for yourself and just constantly advocate for yourself every step of the way. And don't assume that people are going to be reaching out to you to give you the information. You really want to own your information, get your official reports, set up those consults, take advantage of the experience that you had to learn as much about yourself as possible.
Yeah, Dr. Aimee is just a rock star of reproductive medicine. So yeah, listen to her words, because that's true. In many clinics, you don't get this kind of support, and you have to advocate for yourself and you have to educate yourself. And this is very important. So yes, thank you for saying that.
I have to tell you, so I do a lot of second, third, fourth opinion consults. I literally had a patient. I said, well, what did your doctor say about this? And she said, oh, you didn't know? I'm like, what? She's like, oh, the doctors don't call you. That you actually, you agree to that they don't communicate with you at this center. Wow. I'm like, that's insane. So you want, yeah.
Yeah, it is super sad.
That's amazing. And I want to second what Dr. Aimee said as well about just testing early and just going to the fertility assessment. It's very important. It's most of the time even covered by your general insurance, which is very exciting. And also the finding the clinic is very important as well. I was lucky as well that my clinic was very attentive, but if it's not, if you have to go to this clinic, you can definitely advocate for yourself. And on our website, on Blooming Eve, you can definitely find different clinics that with also the pricing. So that actually leads me to the different topic about the pricing here, that there are a lot of tips and tricks that you can do in order to save on egg freezing. So like, first of all, like I didn't know that actually my partner's company covered insurance, covered the egg freezing as well. I thought it's just for infertility treatments, and apparently it was for egg freezing as well. So definitely, if you have the fertility benefits, leverage them. And some of the things can be still covered by insurance in different states as well. And you can also find a very different pricing in different clinics. So it ranges anywhere from $4,000 to $15,000. So it's very different in every clinic.
Yeah, no, that's great to know. Do your research in many ways, in many different ways. Right now I want to switch to the audience, and I want to thank you both for sharing your experience and your knowledge with us. So let's see what we have in terms of the questions. So I can see there is a question about the process. How long does it take? I think we covered that a little bit. It takes 10, 14 days, right, Dr. Aimee? So it depends, but it's up to that. Then there is a question, when can we return to planning for a baby after egg freezing?
I mean, I can literally thaw your eggs the next day. I mean, it's whenever you're ready. And so I have, there's an article that I wrote called The Egg Thawing Party, because I started throwing egg freezing parties in 2014. And then I was like, people need to be educated about egg thawing. I'm not throwing any parties around egg thawing or egg warming. That doesn't sound very exciting. But all the steps as to what to consider when you're ready to thaw your eggs, they're basically in there as a guide for people. And so I actually tell my patients to get their tushy checked before they do their egg thaw. There's so many reasons to make sure that the sperm, for example, we'll just focus on that for a second, is healthy. What you don't want is they thaw your eggs and they combine the sperm with the eggs, and then you find out later none of them fertilized because the sperm was terrible, and that you should have, you know, done your due diligence about sperm and checked all the things and all the genetic tests, put him through a sperm boot camp, so to speak, before you thawed your eggs. So those are the kinds of things that I think about for my patients, but it's all written there. So, and then some patients do genetic testing from thawed eggs. Some patients do some extra tests on the lining of the uterus to make sure they don't have silent endometriosis. So those are all different tests that I offer my patients before they thaw their eggs.
Yeah, thank you so much. Any other questions? If you have questions, please just post it in the chat. So I have a follow-up question of if you decide to be a single mother, because that's not that rare at all. So what are your ways for parenthood?
For a single mom, there are so many different ways. If you're of an age where you run out of healthy eggs yourself, embryo donation is a great way of doing it. So Empower Donation is a great resource. So they're on Instagram, they have a great website, and they match people with like-minded families and create some pretty great connections between people. So, so that's one thing to check out is embryo donation. There's a great film about embryo donation as well called One Last Shot, if you haven't seen it. I promise you there is a happy ending, okay? You might cry a little bit in the beginning, but there is a happy ending. I promise you that. The other option is to actually create eggs, create an embryo with an egg donor and sperm donor yourself. The other option is to go through IVF yourself and use a sperm donor. I recommend that for women who want at least 2 kids and let's say are at least 37 years old, just go straight to IVF. You can also do donor sperm inseminations where you're taking sperm with a nurse midwife at home or at a clinic, and you can do inseminations with donor sperm. But I always share with my patients, it's like Hunger Games for sperm out there. As soon as you find a vial, don't just buy one. If you think you want more than 1 child or you're going to go through IUI, purchase 6, okay? Get maybe 1 or 2 vials more than you thought you would need, because you don't want to, it can be kind of, what's the word? It could be distressing when, let's say, you only bought 2 vials and then you did 1 IUI and you realize, let's say, your fallopian tubes are blocked, let's say, and you love this donor. And then now you have to go through IVF and you only have 1 vial. So I actually do partial thaws for patients where you just take 1 vial and you can thaw it and then refreeze what you didn't use, or you can just do a partial thaw. There are different ways that they can do that in the lab to save a sperm vial. So those are the kinds of things that I think through. And then you can also, as a single person, if you are maybe you still want to see if you're going to find a partner in the future. For some people, that is a goal. And so you can always potentially go through IVF, freeze eggs, and make embryos at the same time.
Yeah, I like that strategy. Well, yeah, and I also like the idea that there is a happy ending. There are other ways. So just don't be stressed. There are ways and there are technologies that can help you to get to your goal. We have another question. I'm 34 and I have ultra low AMH, and my LH and FSH are in perimenopausal levels. I just had my Mirena removed in April, so I'm just wondering what all this means, because now I haven't had my period since IUD, and ultrasound showed 7 follicles with 2 eggs. I have my egg freezing cycle starting in July. Just want to know what other things I should think about.
I think the most important thing is why. Why are you 34 with levels that are showing that you're perimenopausal? So I look at genetic things for my patients, fragile X screen, chromosome analysis. I also look at other factors, like if there's an autoimmune component to this. So I check things like anti-thyroid, anti-ovarian, and anti-adrenal antibodies. If any of those are positive, you might be a good candidate for taking a steroid like prednisone. I would also put you on low-dose naltrexone. And there are a whole bunch of hocus pocus things that I have up my sleeve as well for patients just like you. So I also do ovarian PRP. So I inject it into patients' ovaries, even patients who are doing egg freezing to hopefully increase their egg count before they go through the process. I also have patients use HGH. HGH is used as a performance enhancing drug for elite athletes. I think of it as an egg performance enhancing drug. So in some patients, I don't know why in some patients it helps than in others, where it might actually increase your egg quality and egg count. It doesn't help for everybody. And then for someone like you, who you're at that point where maybe some point soon in the next 6 months, you're actually not going to ovulate again, you're a good candidate for duo stim, which basically means you start your stimulation meds, you get an egg. Then as soon as the egg retrieval is over, you restart your stim if your doctor sees a smaller follicle, and then you try and get that egg. So I've had patients just like you, where I've literally done 9 egg retrievals to get 11 eggs. 6 months later, completely in menopause, FSH through the roof, no follicles. So I feel like we're so lucky that we know this about you right now. And I think that you should find a clinic, and it sounds like you have, that believes in you, believes in your fertility, and will do everything possible to fight for your chance to have a baby with your own DNA if that's something that you want.
Yeah, thank you so much. That was a beautiful explanation. So there are many ways. First step is testing and understanding what the reason for this low AMH is. So you mentioned egg freezing cycles back to back. So is it the common practice? So any other limitations to that?
Everyone's different. So, and someone who has 1 follicle, I'm like, keep showing up. So, every 2 weeks, I would see a patient like Sheila and take a look at her ovaries, see what I see, decide if we should start, wait. But in a patient who has, let's say, over 15 follicles, after that egg retrieval, her ovaries might be too swollen to jump right into another cycle. So for a patient who's highly motivated to just get all her egg freezing done at once, and she doesn't want to wait, I'll invite her into the office and I'll say, let's just take a look and see if your ovaries hate me right now or not. If they hate me, we're going to take a little break. We can take a very short break with birth control pills. Birth control pills are like egg freezing planning pills. We can use them just to quiet your ovaries a little bit, then stop them, and then start meds again. So typically I encourage women who have a higher number of eggs to give themselves 1 month off in between their egg freezing cycles, just to let their ovaries take a break.
How long should be the break?
Just typically one cycle.
1 cycle?
Yeah, just 1 cycle. Yeah.
Nice. So any other tips that we can do in between cycles to, I don't know, any supplements that you would recommend for people to take?
So funny you should say that. So this is something that
I take.
Oh,
okay. Great. Yeah, that's awesome.
So True Niagen, the active ingredient is nicotinamide riboside, and this might increase your egg count. It might improve your egg quality. So this is something I swear by. I'm not trying to have a baby. My AMH level does not mean that I have healthy eggs at 47 years old. There's no way, but I've been taking this now for over 5 years, and my AMH at 47 is 1.1. It's been stable. My cycles are regular, and I kind of experiment on myself with a lot of things, but this is one. And I've seen really impressive results from patients who weren't on it before they met me. Then they start it, and then their cycles are amazing. So this combined with CoQ10. I also have patients take resveratrol. I also have patients who have endometriosis take N-acetylcysteine. I also have patients who have PCOS take Eyvazzadeh. So I individualize my supplement regimen for the patient based on her diagnosis. And then there's a couple other things that I do. I have patients use red light or low-level light therapy. I find that that might be helpful, as well as work with an acupuncturist if they enjoy acupuncture. I never acupuncture shame anybody. If you don't like it, don't go, because it can be a miserable experience if you hate needles and you don't like it.
Yeah, no, I just want to mention that all those methods, there is research and a lot of research covering that. So this is actually a medicine. It's just not a lot of fertility centers do not tell you about that, but this is something that helps. And I want to thank Dr. Aimee for mentioning all of those. Oh yeah, so yeah, we just shared with you a few names of that. Awesome. Any other questions that we have?
I'm wondering if there is anybody from the audience who's interested not in egg freezing, but more in fertility treatments in general. Should we touch on the topic of helping with the fertility? If you are interested, maybe leave some sort of reaction here or drop a comment.
Yeah, so maybe we can cover for now just what types of fertility treatments are there, if like for women specifically, let's say that men factor is eliminated. So what treatments are there for us to choose from?
Very simply, sometimes patients just come to see me because they're confused about when they ovulate. So just because you see a fertility doctor does not mean you have to do treatment. You can also just utilize the clinic to understand when you're ovulating, when you're going to be the most fertile if you're having a hard time. From there, you can also just add inseminations if there's stress in the bedroom. If you're kind of stressed out around sex, you guys are fighting, you know, there's maybe some erectile dysfunction around that stress that can be really like disappointing as a woman, you know, for so many reasons I don't need to explain them. And then I also just, I have no affiliation with this company. It's Mosey Baby. So Mosey is another way of home inseminating around ovulation if sex is stressful for you. Then from there, I call it ovulation augmentation. So another term for it is ovulation induction, where you take fertility pills for 5 days to help you ovulate more than one egg. And people kind of get confused. I'm like, I'm going to give you an ovulation inducing pill. And they're like, but I already ovulate. Why do you need to give me these pills, Aimee? And I'm like, well, let me tell you, if I can help you ovulate, let's say 2 eggs, and it's like a 2 for 1. Like I wish maybe my April Fool's joke, I'm famous for my April Fool's jokes. Maybe my April Fool's joke this next year is I've invented a way for a woman to ovulate every day. Like, wouldn't that be great? Because this waiting, it's like your period starts and you wait for 2 weeks and there's 1 egg and then you wait again to find out if it worked. At least with ovulation induction, you might ovulate 2, depending on your age. Sometimes I help women ovulate 3, even 5. So for women over 40, you don't have an increased risk of twins unless you're ovulating more than 5 eggs. Isn't that insane? That just has to do with the egg viability. And then from there, you can induce ovulation with injections. So not just pills. I like to do a combo approach. I call it the hybrid protocol, where you're taking 5 days of pills, 3 days of shots, and then you come in for a follicle check and possible IUI. Then from there, you also have IVF and then also egg freezing. So there's so many different things that you can do at the clinic. And then if, let's say, things aren't working out with your own DNA, then we talk about egg donation. If it seems like implantation is an issue, then we can work with surrogates.
Wow. Well, that's very interesting. I, for example, didn't know that you can have 5 ovulated eggs and then you don't have a risk of having like triple, double, and etc.
Yeah, when you're over 40, age matters. If you're 20, that's a different story. Then you're signing yourself up for, you know, triplets. But if you're over 40, because of egg viability, with each egg is has a 10% chance of being genetically normal. So ovulating 4 would actually give you 4 or 5 would give you the best chance of having a single baby.
Wow, this is awesome. Yeah, that's great to know. Well, so it seems like we do not have questions. I I think that people are just tired on Friday, Friday evening. They don't have any questions about fertility anymore. But I want to thank you so much for being here today and sharing with us your knowledge. And I just want to say that Dr. Aimee is, yeah, this is just the best of the best. So what you're hearing here, you're missing big time not asking questions. I can just stay here asking questions the whole evening. But yeah, I need to let people go. So thank you so much, everyone, for
Thank
being
you.
here today again. And yeah, so just want to mention that we are Blooming Eve. We are a fertility marketplace. We help to find fertility centers by the price, by the clinical quality, reviews, and etc. near you. So if you are considering any type of treatment, so you can go to our platform and easily find it and book an appointment with a fertility center. So please do that if you decided that you are ready to go with it. But otherwise, thank you so much, and I'm so grateful that so many people want to be educated about this topic. That's super important, and that's why we are doing our job.